Another week of pressure on healthcare professionals as the pandemic surge continues. Southeast Georgia and Northeast Florida, a hotspot for COVID-19. One of the nation's hospital leaders joins us with his view. We also get the view from Tallahassee.
The emergency room visits in Duval County for COVID-like illnesses over the past week have decreased by 14%.
Does the CEO of Mayo Clinic share the optimism of Governor Ron DeSantis? School is back in most of the local counties. In some ways, it's a rough start with both teacher and student absences. We'll discuss the opening week with Duval County's vice chair of the school board on This Week in Jacksonville. So grateful you're with us today. We're continuing to cover the surge in coronavirus cases, especially in our region. Joining us today by Zoom, Dr. Kent Thielen, the CEO of Mayo Clinic Florida. And Dr. Thielen, we spoke on this show in May, not even 3 months ago. But because of the Delta variant, the surge of cases, doesn't this seem like a very different place on the pandemic timeline than back in May?
Absolutely, Ken. And first, thanks so much for the opportunity to join you here today. And back in May, I think we're feeling fairly good about how things were progressing with our capabilities around vaccines and whatnot. But we have encountered a recent surge here, starting about the beginning of July. We've seen significant upward trend in the number of newly diagnosed patients with COVID, and that's translated into increasing numbers in our hospitals. And we're no different here at Mayo Clinic. And this current surge has had the most significant impact from just a volume of patients that we're caring for. It's about twice the level or number of patients in our hospital now compared to our most significant previous surge, which was in January earlier this year.
Yeah. Dr. Thielen, I know other hospitals are reporting cases and deaths from COVID-19 and kind of doing that on a regular basis for us. Why not from Mayo? Is there something that organizationally you don't want to do that?
Yep. What we are doing is we are sharing on a week-over-week basis the percentage change in the number of COVID patients that we have hospitalized. And we're also sharing data, of course, with those agencies and other healthcare organizations like the Duval County Emergency Operations Coordinating Teams and the Florida Hospital Association, of course, our state and federal officials. Overall, this is an enterprise approach, is how we approach this as an organization. We think that data and numbers require context and are best managed and shared internally where that full context and the implication of those numbers can be understood. For instance, I can give you just a couple of examples where context might matter. We have a virtual capability with home hospital. We call it advanced care at home, where we're caring for some of our COVID patients in the comfort of their own home using virtual hospital capabilities. Those numbers won't be reflected in our bricks and mortar hospital. Also, some smaller hospitals, the absolute numbers might look significantly different as opposed to percentages of beds impacted and those types of things. So that's the approach we've taken at this time, but we are very collaborative with the state, our local officials, and other hospitals to make sure that we're all working together.
Yeah. Dr. Thielen, I want to talk about a couple of things Governor DeSantis from Florida has said. He was in Jacksonville a couple of times this week. One of the things this past Thursday, he announced a new rapid response unit. It's going to be in downtown Jacksonville. He said it's going to administer monoclonal antibody treatment to high-risk residents in the early stages of COVID-19. What can you tell us about this monoclonal antibody treatment? And it sounds, from what I've heard from you, that Mayo has kind of been at the forefront of that.
Yes, it's an excellent therapy. It's something that since it first became available in November of 2020, we've been very strong advocates for as an organization nationally, as well as here in Northeast Florida in the Jacksonville area. We've had a clinic that's open on a daily basis to infuse patients with monoclonal antibodies. Those are patients typically who are recently diagnosed. You need to treat patients, in a short period of days after they've been initially diagnosed. And typically these are patients who have some significant underlying healthcare conditions as well. But it does significantly reduce the chances of those patients going on to need to be hospitalized. It also can reduce the length of their disease severity. And so we think it's an outstanding therapy. We've done over 1,100 patients here since November of 2020. And we have a capacity to treat over 200 patients a week. So we think it's very important. This is a great step to expand that capability here in Jacksonville. I know that many of the other hospitals here in the Jacksonville area also provide this therapy. And so I think if an individual is newly diagnosed with COVID, it's something that they should explore to see if they are able to access this capability based on their particular healthcare circumstances.
I would imagine more people will be asking about it, hearing from the governor this week. And Dr. Thielen, I want to ask if you agree with what we heard from the governor earlier this week. Governor DeSantis said the 7-day average for cases in Duval County decreased 18% since July 31st. Said emergency room visits for COVID in Duval County decreased the prior week by 14%. He basically said he was happy with the trend. Do you agree with the governor's read on decreasing cases and where we're headed here?
Yeah, we closely follow internally data related to hospitalizations of COVID patients. We also have a drive-through testing center for COVID that we monitor the demand for testing there, the positivity rates. And what I can say is, while we still are at a very high level, nearly twice the level of where we were in January of 2020, we have seen a plateauing over the last probably 7 to 10 days. And actually over the last few days, we're seeing perhaps some indicators, you never know with a virus like this, but perhaps some indicators that we're actually seeing a decline in the total number of patients. And we've actually have about 5% less patients hospitalized in our hospital with COVID now compared to a week ago.
You know, it comes to mind for a lot of people. Will you consider canceling or postponing scheduled visits, procedures, outpatient surgeries, those kind of things because of where the surge has taken us?
Very good question. Our teams are continually monitoring and responding to the current situation. And we do what's necessary to appropriately care for our patients. And that includes coordinating schedules in ways that safely meet the needs of our patients, both COVID patients and non-COVID patients. And we'll continue to actively manage our clinical practice to meet the patient needs. At this time, Mayo patients who have scheduled appointments, we are encouraging them to continue to seek care as needed. And in specific cases, we may make modifications to schedules given to the circumstances in the community and how they may evolve in coming days. But I would say those are on a case-by-case basis. There are also many anecdotal examples of patients putting off care for non-COVID related conditions, including serious non-COVID related conditions that have ended up in the ER with very severe situations, or even tragically haven't made it to the ER. So depending on the particular healthcare circumstance, we do encourage patients to continue to seek out healthcare when they need it.
Yeah, I've got at least 2 more questions for you, but I'll be brief here. Has Mayo asked for or brought in more ventilators? I understand some of the other area facilities have brought them in.
Yes, and so very good question. One of the tools necessary to treat COVID patients in addition to significant amounts of oxygen. And we are an enterprise organization. We have the capacity to work with our colleagues that exist in the Midwest, in Rochester, Minnesota, and in Arizona, and share resources. And so we have brought in some additional ventilators from our organization broadly to make sure that we have adequate capacity. I can tell you that we're in a very good position at this point in time, though, from a resource standpoint, should there be a further increase. We're keeping our fingers crossed that we're seeing a decline in COVID cases, but should there be a further increase, we're in a very good position to have adequate numbers of ventilators.
Final question for you. There's apparently an extreme nursing shortage going on right now. According to the U.S. Bureau of Labor Statistics, U.S. is going to need another 1.1 million nurses by 2022 to handle the current shortage. How does that play out at the Mayo Clinic and your various locations?
Yep, very good question. Clearly, there is a national shortage of nurses. As an organization, we work together. We have an enterprise employee base, and we're able to flexibly move nurses as necessary. Like during the current COVID surge, we're able to move in nurses from site to site. We also try to, on a pre-COVID level, we try to provide an environment where our nurses want to seek out and have opportunities to work in the care of patients with serious and complex healthcare needs, and that really allows them to advance their training, broaden their skill sets, and prepare them for, career development. Also, we're working closely with academic institutions, both here in Northeast Florida, as well as in our other locations around the United States, to help enable and enhance the capacity to increase the numbers of nurses.
I appreciate it. We got through a lot there. Dr. Kent Thielen from Mayo Clinic, thank you so much. We know it's a pressure-packed time. Appreciate the time today.
I appreciate the opportunity to join you. And I just want to say thank you to all the healthcare workers here at Mayo Clinic and across our Northeast Florida region. They are working incredibly hard. They are flexible, engaged, resilient, and they're doing fantastic work for the people in our community.
Pretty important work, too. Thank you, Dr. Thielen. Appreciate it. All right, so stay with us. We're going to shift our focus to education when we come back with Daryl Willey, the Vice Chair of the Duval County School Board, is next on This Week in Jacksonville.
The Olympic Games are on, and Toyota has great deals on Camry, Highlander, RAV4, and more.
Right now, get 0% APR for 36 months on a new 2021 Toyota Highlander.
But it all ends September 7th.
Toyota, let's go places.
Recent studies have shown that too many leg and foot amputations are performed without a second opinion. If this has happened to you, call us. We'll review your case for free to see if your amputation could have been avoided. Farah and Farah.
Things seem to get more expensive as years go by. Take groceries. Prices have been going up there. And keeping up with your health, that's up too. But did you know at FPL, what you pay for energy has gone down over the last 15 years? And that's something we can take to the bank.
The fact that this Reese's ad showed up at this exact moment proves that your devices are listening to your stomach.
Well, hello, Winn-Dixie.
I wanna win!
Look at that big bag of wins. Perfectly picked. Delivered super quick. Wow, look at that big bag of wins. Perfectly picked. Delivered super quick.
We just start at WinnDixie.com/shop online, build our cart, choose a delivery time, and boom, time to kick back and win. Best quality, winning grocery delivery. Winn-Dixie, it's a win-win.
Marine 4 on News 4 Jax, Channel 4, the local station.
You just want to meet your new niece.
Here she is.
But if slow upload speeds were to freeze your face and you accidentally snub a newborn,
Nothing is ever good enough for you.
just remember, you're not a bad sister.
This is going to be a problem.
You just need better internet.
AT&T Fiber delivers a faster internet experience with 25 times faster upload speeds than cable. Get AT&T Fiber. Plan starting at $35 a month for a year. Limited availability in select areas. Call 1-877-ONLY-ATT.
At Farah & Farah, when you fall down, we stand up. Don't let the insurance company play around with your future. Call us.
Toyota's national sales event is on now.
Right now, lease a new 2021 Toyota Corolla LE for just $199 a month for 36 months.
It all ends September 7th.
Toyota, let's go places.
Don't let inconvenient weather crash your plans.
Blue skies in the morning, showers and storms cranking up.
Chief Meteorologist John Gahn and the Weather Authority. Your forecast is our forte.
We've got cloudy and damp conditions.
Exact Track 4D, counting in every minute to expect delays.
Oakleaf in about 40 minutes time.
Whether you're a rock star parent or steering wheel soloist, stay tapped in and never miss a beat.
If you have the Weather Authority app, you just got an alert.
The Weather Authority on News 4 Jax. Always watching, always tracking. You're watching This Week in Jacksonville with Kent Justice.
St. Johns County schools will begin this coming week, but Duval County, many others, they are already underway. Joining us right now, Daryl Willey, Vice Chair of the Duval County School Board. Thanks for joining us. Let's talk about back-to-school concerns and precautions. How is this year going compared to the start of school in 2020?
Yeah, we're back. We're back in full effect, Kent. And what a great start we've had to the school year thus far. All our students have gone in. Many of them are in brick and mortar right now, but we do have options for parents. We still have Florida Virtual and Duval Instructional Academy. And just honestly, our teachers are our frontline workers, our heroes. They have built so much muscle memory from the past year on how to create the safest environment for our students, but also the greatest academic environment. So thanks to all of them and our staff for putting that together. And honestly, our biggest issue this year, Ken, has been operationally, transportation. We've had some bus issues the first couple of days. Superintendent recognizes that. We profusely apologize to anyone, families that have had issues getting their students to or from school. We're working with the bus companies now to make sure we can make changes to make that better. And COVID has done it. The workforce is slim when it comes to bus drivers. So we're going to work through each phase of it, because we're transporting about 50,000 students every single day.
Wow. Yeah, that's a big ask. That's a lot of kids to move around there. Hey, so did the board's decision on mask recommendation and an opt-out, not a mandate, did that really, do you feel, attend to both the needs for the district and meet in the governor's executive order?
Absolutely. It's not a fight against the governor. It really is a fight against COVID-19, this virus that is ravishing our community and really affecting everyone. Every single person is affected by this. So we took every inch of territory that we could to protect our students and our staff, while understanding that the governor had a directive for parents' choice. And we created an opt-out for parents to choose. And right now we're seeing some pretty low numbers in opt-out. We have less than 9% who've opted out, which is keeping our schools safe and open. And we're one of the first districts actually to actually create that space and create that opportunity for our staff, because the governor's mandate came quickly right before we started school. But it's only emergency order, so it's for 90 days, and we're going to reassess. We're keeping a close eye on COVID numbers. We have a dashboard up right now on our website that you can check out. It updates every single night with dashboard with COVID information. And we're working with health officials. So we're willing to come back to the table and willing to see what happens in our community to make sure we can keep kids safe.
So, Vice Chair Willie, so we heard that 13,030 students were absent on the first day of school in Duval County. That's roughly 10% of the total enrollment there. Right. And then teachers, I know they've got up to 10 days to adjust or update the attendance numbers, but we heard that 96 teachers called out on the first day. That's compared to 80 on the first day of school last year. How do you feel about those numbers?
Yeah, those numbers are, I mean, it's quite typical. We have a huge teaching staff. We have thousands of teachers. So to have those numbers come in, we understand that. But what we do have is we have great relationships with our substitute providers, and they were ready to go. So we had a lot of backfill to ensure that classrooms were filled with a teacher, a certified teacher, or somebody who could actually run that classroom. But we're working diligently on that, both from the teacher side and the student side. We have groups and community partners who are out right now making phone calls, doing neighborhood visits to ensure that folks know school has started. So we started on a Tuesday, which is an odd day, Kent. So we got to make sure that folks understand we started school, it's in session, so come on back. So if you're listening to me now, students out there, school has started, come on back. We got some great opportunities for you inside the four walls of our amazing school.
Even if it is August, and even if it was a Tuesday and all that kind of thing. Hey,
Right.
Maybe final
Exactly.
thing here. I know the Florida Education Association says that there are nearly 5,000 teaching vacancies and more than 3,700 open staff jobs. How does that affect Duval County?
It's a constant battle that we're trying to fight, is trying to keep as many great folks in our classrooms as possible. And we're no different than any other district around the country where that's one of our main focus areas, is recruiting and retaining as many top talented individuals as we can. We're actually doing a pretty good job. We have about 96% staffed right now going into the school year, which is pretty amazing, actually, considering all the different things that are going on. But it's really about this notion of elevating the level of the profession of teaching, making sure folks understand that you can be a teacher, that it's valuable, that as a college student, you can still choose to be a teacher. We just have to make sure we elevate that, Kent, because we're doing the things we need to do. We increase the pay for incoming teachers. We're creating the type of culture and environment that teachers want to be in. Now it's just a matter of marketing it, advertising it, and making sure people come. Because I was a teacher, and it's one of the most, if not the most rewarding jobs you can ever have. So we're excited about it. We got some programs if folks want to come in, and if they have a bachelor's degree, we'll get you the professional development to be a teacher in our schools, because we need you, and our students need you.
You mentioned rewarding, also challenging, and what a challenge for leadership in every school district throughout the state of Florida and probably throughout America. Darrell Willey, Vice Chair of the Duval County Public Schools Board, thanks for your time today.
Thank you.
All right, so just ahead, a look at some of the details surrounding two downtown development proposals in Jacksonville. Nancy Powell is with us next on This Week in Jacksonville.
You know that fresh made-to-order salad you've been craving? What if you could get it with fire-roasted corn, crispy tortilla strips, and Southwest ranch dressing? That's what we call the Southwest Salad. It's brand new, and it's only at Zaxby's. Redeem rewards, scan to pay, order ahead on the Zaxby's app.
If you've been injured by medical malpractice, call Farah & Farah for a free review of your case, even if another firm has turned your case down. Farah & Farah.
When you're shopping for a new vehicle, how do you know which brand you can trust? With Subaru, you get Kelley Blue Book's most trusted brand winner 7 years in a row. In fact, Subaru has won most trusted brand for more consecutive years than any other brand. No wonder Kelley Blue Book also picked Subaru as their best overall brand, once again. It's easy to love a brand you can trust. It's easy to love a Subaru.
It's the question everyone is asking. Once you get the COVID-19 vaccine, what can you do safely that you couldn't do before? Then,
listen, forget Fauci. It's all about Dr. Oz, yo.
Music icon Randy Jackson opens up about his dramatic health reboot.
Monday at 10 on Channel 4, the local station.
Next time you head to Florida, expect an even warmer welcome with Easy Pass. Now you can use your Easy Pass to pay for tolls on Florida's toll roads and most bridges. Take advantage of more convenience and more savings with one toll account, all across the Sunshine State. After all, on vacation, shouldn't everything be a little bit easier?
Hey, school's in session, and here's today's lesson. I'll give you not 1, 2, but 3 reasons to buy. We have the vehicle you're looking for with a wow price you expect. We're fast, fair, and transparent, and every new car comes with a 20-year, 200,000-mile warranty. Plus, every purchase supports our local schools, teachers, and students. Your next assignment, get to Beaver Toyota in St. Augustine or Beaver Chevrolet in Jacksonville to help support your local schools. Deadline, August 31st. We're here to wow you and our teachers.
After practicing for 30 years in this community, we have grown, but we have not outgrown the size of our heart and our family. And we always want our clients to feel that they're being treated like family. That's how we get our best results.
Imagine a salad made with fresh-cut vegetables and warm hand-breaded chicken. Does that even exist? Not yet, because we don't make it until you order it. Try the new Southwest Salad, only at Zaxby's. Order on your favorite delivery app.
You're watching This Week in Jacksonville on Channel 4.
Yeah, we're talking about activating Jacksonville's Riverfront in this segment. Joining us is Nancy Powell, Executive Director of Scenic Jacks. And your role at Scenic Jacks also including advocating for a more scenic and sustainable Jacksonville. That's what I read. Also chair of the Riverfront Parks Now Coalition. And I love this tagline because great cities have great parks. Nancy, tell me about this. Are you excited about these 2 recent proposals and plans in the downtown area right now?
We are very excited about all of the attention being given to the riverfront and especially the public spaces along the riverfront. We started our advocacy about a year ago. We are a coalition. The Riverfront Parks Now is a coalition of 14 nonprofit organizations that have come together to advocate for what we're calling a riverfront for all. And we have over 70 acres of public lands, city-owned, taxpayer-owned public lands. We feel a good portion of that could and should be used for the public with parks and green spaces for resiliency, for community gathering, and for economic impact.
So the couple of proposals that I was interested in, I think fit into what you were just discussing. We've got lots of info on the Shipyards proposal by Shad Khan's company, Iguana Investments. Maybe walk us through what's key there when it comes to some of your efforts.
Well, the Shipyards is really 2 pieces, two big properties. It's the Shipyards, which has been vacant for 30 years. It's about 30 acres of land. And then just next to that is the Metropolitan Park and the old kids campus, which used to be a very vibrant area and has just been neglected. So the proposals on the table are to really refocus the energy on that spot with the Iguana proposal is for a 4 Seasons hotel, and the DuPont organization has come up with a conceptual plan that brings a lot of the rest of the space into a connected park that would also complement the other areas and the whole stadium district, where there's a number of things going on, including a ship that was just approved to come there. And, there's a new Berkman Plaza is going to be redeveloped. So there's a lot of attention in that area.
I wanted to point out, and we'll show some video here, but there's a winning proposal now for the former landing site in downtown, Riverfront Plaza. Perkins and Will, they received the highest marks out of 3 designs that were presented to the DIA. So we know there's going to be a beer garden, hotel, play area, multi-million-dollar, 151-foot stainless steel Jacks sculpture. What are your thoughts there? Are you inspired? Are you in favor of this?
Well, we are very excited by the park plan. The the sculpture is a part of that, but the park itself that was been designed has many incredible features, as you can see here, with lots of shade trees and different amenities that will bring people to the riverfront to enjoy. It also has an area for retail and restaurants, which is something that the community has been, dying for since the landing was torn down. And so it really has a play space, and as you can see from these pictures, it's going to be very exciting. And so the investment required here is for the city to continue its negotiations with Perkins & Will, finish the design. The design's only 50% done, and then build this park, which will be very exciting.
Nancy, as we were preparing for our interview, you pointed out a specific map for activating the city's riverfront public space, and I've also seen a 10-point plan to create a riverfront for all. What's most important about that?
Well, what's most important is the public access and of our riverfront. Everybody agrees that our river is our greatest asset, and it can be a draw for downtown, for people within the city as well as visitors. And that's really what we saw in studying other cities, is that the waterfront areas and waterfront parks in particular bring people to downtown and help revitalize downtown areas. There's no question that our downtown is in need of some more people down there and more vibrancy. And so that's what we see in many other cities: St. Petersburg, Tampa, Sarasota, Chattanooga. There, you just name a city that has a river and you will see a large riverfront park. And so that's what is exciting here, is that we are getting that message, and it can complement all the other good things that are happening downtown.
Yeah, and as we're talking about downtown, and specifically kind of with that arena area or the sports complex, there's also some things happening on the South Bank that we're not going to get into right now. But as these development proposals come up, we want to reach out to folks like you and Downtown Investment Authority. We want to find out if they're really going to nudge forward. And I think that's part of the excitement that people are seeing, even just hearing from you this morning. Nancy Powell, thank you so much from Scenic Jacks and from what you're doing to advocate for some growth. Appreciate your time.
Thank you so much. Okay.
All right, so we are working to bring Senator Marco Rubio back to our show. We're going to get his insights on the fight to help people living in rundown conditions in Jacksonville, including demands that he made to the Federal Housing Department. This Week in Jacksonville airs each Sunday morning this time. I'm Kent Justice. Thanks for watching on air on Channel 4 and the CW17, and you can find us online at news4jax.com.